Hello, everybody, and welcome to this introduction to a very interesting initiative looking at prediabetes, which is today called by WHO and IDF in a different way, because WHO prefer to name the prediabetes as intermediate hyperglycemia. But I will be back on the reason of this change. My name is Antonio Ceriello. I am a research consultant at HIRCCS Multimedica in Milan, which is a research institute, but also I am adjunct professor of internal medicine at Vanvitelli University in Naples. So what we will want to learn, and of course we will share in this webinar, which will be held on May 29, is how this concept of prediabetes slash intermediate hyperglycemia is growing in interest today. Why? Not only because there is a huge number of people in this such condition, but now it's more and more clear that the prediabetes is accompanied by very high risk for cardiovascular disease, including heart failure and kidney disease. And of course, the impact of these comorbidities is very important because expose people not only with the pre-diabetes, not only to develop diabetes, which by itself is a very dangerous condition, of course, but also before of developing diabetes, to suffer for this kind of complications.
Why is it important for patient outcomes to have an early diagnosis of prediabetes/intermediate hyperglycemia?
Oh, today it's more clear that an early diagnosis of the condition of prediabetes slash intermediate hyperglycemia is really a cornerstone to prevent the development of diabetes, but particularly of the possibility of developing very serious complications, meaning cardiovascular and kidney complications. The way to do this, it's now well established. Of course, we will have the possibility of intervening after the diagnosis, but the evidence is stressing the concept that as early possible you make this kind of a diagnosis, as early you are able to identify people at high risk, the chance to avoid the complications, and particularly the development of diabetes, is very high. This concept is stressed in the change of definition that the WHO and proposed 1 year ago, almost 1 year ago, and IDF was immediately accepting and now is sharing this new definition. Even I have to be honest, in terms of terminology, is more complicated to say intermediate hyperglycemia than prediabetes. But the concept of saying intermediate hyperglycemia is that we give hope. We give hope to the people that in such condition you can be back. This condition can be reversed. It's not really a fate that if somebody is in a situation of damaged glycemic metabolism, the outcome must be diabetes and its complications. There are several strategies that will be discussed, largely discussed in these webinars. And the very important stuff is that we have evidence that the so-called legacy effect, which is a phenomenon well known for diabetes, can be present also in the condition of prediabetes, meaning that an early diagnosis favoring an early treatment can prevent not only the appearance of overt diabetes, which by itself is also enough, very important, but particularly also to act to prevent serious complications like cardiovascular complications, including heart failure and kidney complications.
What is the psychological impact to the patient with an early diagnosis of prediabetes/intermediate hyperglycemia?
Is can be very different because the concept itself is not clear for the people if you do not spend enough time to explain the meaning and particularly the future of this condition, because is why WHO decided to adopt the term high intermediate hyperglycemia, because you can act, you can do something for the people in such condition, because of course the first approach is a huge lifestyle change, meaning to improve physical activity, to change the diet, and losing weight in the case of obesity or being overweight. Clearly, this is something that is not easy to accept for the people, because also this means that this will has to last for all the life, not just for a short period. And further, because we have evidence that some pharmacological treatments, particularly, for example, metformin, which is a well-established treatment for prediabetes in order to prevent diabetes, but also in this case, you have to start as early as possible. All these can be perceived as an important change of the quality of life. So people could or not could be highly motivated to act, because you are inviting people to really change their lifestyle, to consider that there is a huge risk for important disease like diabetes, that there is a huge risk for developing not only diabetes, but particularly very serious complications like cardiorenal complications. And because people are not having real symptoms in such condition, they do not feel pain, they do not feel any kind of limit. It's very difficult to accept and to change. You know, like the lifestyle change is something very complicated to obtain in the real life. So again, the psychological reaction can be very, very different between people, meaning that somebody can be really motivated, reacting in a good real way, checking, for example, the change in body weight, but also the levels of glycemia very often, repeating the tools that will be discussed more deeply in these webinars, meaning what kind of approach we have to an early diagnosis, with kind of OGTT is accepted, the role of 1 hour or 2 hours postprandial glucose or post OGT or during OGTT glucose, and to implement physical activity. So all these may impact differently in the people, because again, this is really an individual reaction. That is why usually to be successful, you should need the help of a psychologist, because nothing is more difficult than changing the lifestyle. It requires time to be profoundly convinced that what you are doing is very important for yourself, and also to battle what is happening every day in your life. Because what happens that you receive continuously messages from media, from the TV, from anything that food is good, it's good, of course. Uh, the, that you can do relax, you can drink good alcohol, for example, and so on. So there is a huge um, uh, pressure to have a unsafe lifestyle. And to be convinced to change means to be very, very motivated. And again, I stress the concept. This is not difficult to make in a short term, but what is really difficult is to keep this lifestyle in long term meaning all the life.
How can the predisposed risks to developing prediabetes/intermediate hyperglycemia be addressed when patients are asymptomatic?
Oh, first of all, yes, because we are just speaking about early diagnosis, but of course, I really could check everybody, but this is not real. There is an important, very important role for GPs because they see more than any specialist the people in such conditions. And probably also the media may have a very important role because it can improve the awareness about this problem. And then we are speaking about to push people to recognize that this situation exists. Second is who needs to be screened because we cannot screen anybody. But if you have people overweight, for example, and or with genetic predisposition with inheritance for diabetes, and also with some comorbidities like hypertension or the metabolic syndrome, which is a well-known syndrome, including obesity, diabetes, hypertension, dyslipidemia. So it's a typical condition. So all these people, particularly when they are advanced in age, they need to be checked. I have to say that today the concept of the age is also changing because in the past this was belonging more to almost old people, not clearly old, but let's say with advanced age. But now, with the new lifestyle, you see these conditions present in very young people. Very often, we make the diagnosis of over diabetes in people even below 30 years. And when you suspect the presence of prediabetes, you can check the risk. How? And this will be deeply examined in our webinars. There are several tools. Now, today, we have the possibility, for example, to use the OGTT in a simplified way. We have a huge evidence that during an OGTT, the value at 1 hour of glycemia should be easy enough. You do not need to prolong for 2 hours. Of course, you spare 1 hour. And also at the horizon, we also may have the use of a continuous glucose monitoring, which in my opinion, and not only in my opinion, could be the best solution because with the continuous glucose monitoring, you will check the real situation in the real life. Because do not forget that anyhow an OGTT is using an unphysiological stimulant because you give 75 grams of glucose, which is not physiological at all. So at Horizon, we have new tools, new way to screen. We need to screen earlier than in the past, meaning at earlier age. And the perspective is to implement lifestyle, but also to use very well established treatment, cheap treatment, safe treatment for us metformin overall.
What take home messages do we have at the end of this interview?
First of all, remember that this important webinar will be held on May 29-25 from 2 to 3 p.m. Central Europe time, and of Central European summertime, because of course in May will be summertime in Europe. And then the message, the final message is that attend this webinar. If it's possible, it will be possible to get the new advancement in what means today and why we need early screening for prediabetes, why WHO decided to change the definition from prediabetes to intermediate hyperglycemia, and what are the serious comorbidities which are linked to this condition, and particularly what we can do to avoid the appearance of overdiabetes and its complications.